As a first time mom, I'm sure most of the time you have this thought that for your newborn baby, there are certain conditions that the baby must go through, and you won't know what to do about it. You won't know when to see your pediatrician. Well, in this video, I'm going to be taking you through what you need to do and what those conditions are. My name is Dr. Stella. You're welcome to Little Angels Corner, your favorite channel on parenting tips for your little ones. Today, we're going to delve into the areas of a few common conditions that most newborns go through. Most of the time, these conditions are quite mild and there is no cause for alarm. However, I'm going to tell you when you need to stop self-medication and go see your pediatrician with the baby. You take your baby to see the pediatrician. So, the first one is neonatal jaundice. What is neonatal jaundice? Neonatal jaundice is a condition whereby the baby's eyes and skin are yellowish. There is a yellowish discoloration to the baby's eyes and skin. What causes this jaundice? This jaundice is actually the outcome of the baby's inability, especially the liver, in preterm babies and even the full-term babies. The inability of the liver to process the breakdown products of the red blood cells in the baby's system. What do I mean by that? Usually, when a baby is in utero, that is in the mother's womb, the baby needs a lot of red blood cells to survive. But once the baby is born and starts breathing by himself, then there is no need for that number of red blood cells. Therefore, these red blood cells are broken down and the breakdown product is handled by the liver. In most full-term newborns, the baby is able to do it without any problem. But in the preterm babies and some few full-term newborns, the baby needs some more time to be able to break down these red cells, and it's passed out in urine. So due to the baby's inability to process this product of the red blood cells, it appears as jaundice in the eyes and on the skin. But there is no need to worry because it's a physiologic process most of the time. When I say physiologic, what do I mean? It's a natural process. So that by the time the baby is a week to 2 weeks old, the baby is able to handle it. However, there are some causes of jaundice that may not be physiologic, that is natural. There are some that may be due to incompatible blood group between mother and baby, and even father. And sometimes it may also be due to infection, sepsis, and so many other things. So there is no way you as the mother can tell what the cause is. So the best advice is when you notice that your baby has a yellowish tinge in the eyes or the tongue, the lips, or the skin, best to see your doctor. Don't stay home and say you'll manage. Please take to your pediatrician. Most of the time, the treatment is simple. The baby is put under the light, which we call phototherapy. So aside from this now, the baby may also have what we call ophthalmia neonatorium. What do I mean by that? Ophthalmia neonatorium simply means infection, conjunctivitis of the eyes in the first month as a newborn. The cause of this is it's due to an infection. Sometimes it may be chemical irritation, but infection is more common. And usually bacteria are the culprit. Occasionally we may have viruses also being the culprits. So as the mother, what do you do? The first thing is that you'll notice that the baby is discharging from both eyes. Sometimes it could be one eye, yellowish discharge, purulent. Sometimes may even be clear, mucoid discharge, especially if it's viral in origin or chemical in origin. So what you do for the first few days, just get clean water, get clean cotton wool, put the water in the cotton wool, and then wipe this discharge away from the eye, starting from the inner part of the eye away, both eyes. Even if it's only one eye that is discharging, wipe away from the eyes. And if this and wipe as often as you see the discharge. If this discharge continues beyond 3 days and it's getting more excessive, please don't hesitate to see your doctor so that your doctor or your healthcare provider will know what to do. In the hospital, they're going to go through some tests and know the right antibiotic eye drops to give to the baby. Do not opt for over the counter medications. It's not the best for your newborn. And then another common condition that the baby may have is abdominal colic. This is quite common in most newborns, and usually it starts from the first few weeks of life right up to 3 months. And what you see is that baby cries incessantly for no obvious reason for greater than 3 hours, and up to 3 times in a week, and usually in the nights when everybody is sleeping. That is when this abdominal colic is worse. The cause has been attributed to immaturity of the gastrointestinal tract. The baby is still trying to process the feeding that he is getting, either breast milk or formula milk. The gastrointestinal tract is still trying to adapt to the new environment outside the womb. And most of the time, what happens is that it's made worse when baby is breastfed or bottle fed and is not allowed to burp. Baby mother is advised to allow baby to burp, that is, bring out air from the mouth after feeding. The best position to put the baby is on the shoulder so that the gas can come up and is expelled through the mouth. Sometimes baby has to be on your shoulder for as long as 45 minutes. If the baby does not burp, does not bring out gas, do not put the baby down, because part of the problem of the pain that the baby experiences, that discomfort, is due to gas in the bowels. But if there is fever and vomiting with this abdominal colic, please don't sit back home. Go see your pediatrician as soon as possible, because abdominal colic is not accompanied by vomiting, nor fever, nor stooling. If you have any of these complications, please don't hesitate to see your pediatrician. And then commonly again, most newborns do have, not most, some newborns do have nappy rash. So what is the cause of this nappy rash? It's due to constant dampness of the skin in that groin area. The mother is advised to air the place from time to time, because if baby urinates or passes to, and there is constant contact of this product from the baby onto baby skin, it is bound to cause irritation, and therefore rashes may appear. So what is advised is that change your baby's nappies every 2 to 3 hours, so that in a 24-hour period you may see yourself changing the diapers 8 to 10 times. And then in between, please air that area. Do not even put any diaper on. Just put the diaper underneath the baby, but expose that area so that by airing that area, it dries up completely before you think of putting a new diaper. And when you do change the baby's diapers, always remember to clean the baby properly in that area using unperfumed, unscented, and non alcohol based wipes. Better to use plain wipes and then just water to clean that area. Also, if the rashes do appear, it will be good for you to just use mild products that don't have any active ingredients like Vaseline, pure Vaseline jelly, or shea butter. Most of the time, this will suffice to deal with those rashes, especially in the early stages. Apart from nappy rash, baby may also come out with other rashes in other parts of the body. Baby may come out with contact dermatitis, that is in areas where the baby's skin is in contact with a factor that the baby's skin may be allergic to. So, for such a situation, what you do is observe and see. Is it when baby uses certain baby products, i.e., the soap, the powder, or the gel, that baby comes out, breaks out in such rashes? If that is the case, it is by withdrawing those products that you'll see an improvement. However, if there is no improvement, do not hesitate to see your doctor. Sometimes baby will also, especially in the first few days of life, come out with rashes on the face, on the forehead, the cheeks, that we call miliar rash. That usually is a mild process, is a mild condition, and it's essentially some waste products on the skin that is dead skin. It is dead skin basically. That goes away after some time. All you have to apply on that area of the skin is just mild baby powder that the baby is not allergic to, and in no distant time it will clear. There are other conditions, but this first video will just deal with the very common ones. Hopefully, I will put up another video to deal with other conditions that the baby may have in the first month of life. So, mothers, I've tried to allay your anxiety about certain conditions that the baby may have in the first 3 months of life, especially in the first month. As a first time mother, there is no need to panic. Just see that you're observant, do what you can as a mother from what I have told you. However, if by the second day you are not comfortable with it, best see your pediatrician. I hope you found this video helpful and interesting. If so, please like, share, and subscribe so that it can get to other mothers, and together we can build a community of well-informed mothers that will bring up healthy babies. Thank you. Bye. See you in my next video.